Hello, my name is Dr. Elaine Halley. I'm a general dental practitioner. My practice is Cherrybank Dental Spa in Perth in Scotland, and I've been here 30 years this year, since 1995. I'm also the clinical director for a small group of practices across Scotland, the Pain-Free Dentistry group. So I divide my time between working in my own practice here in Perth and also mentoring associates across the group of practices. So in 2010, I opened a second practice in Edinburgh, and it was during that time that I first contemplated using intraoral scanners in practice and looked at iTero first of all. We really built that practice using Invisalign and the digital workflow that existed at that point in time. So we invested in the new iTero scanner in around about 2011. So because we've been working with the intraoral scanners for many years, we started with the iTero Element scanner, and we've progressed through, and we now have the 5D Plus and also a Lumina scanner in practice. We've really embraced utilising intraoral scanners as part of our everyday practice. So they are used right from the very beginning of the patient experience as part of the dental examination. So we now consider our scanner the most important part of looking in a patient's mouth. So before I even lie the patient back and look with a mirror, we will have taken a scan so that we can instantly refer to the scan before we're doing anything too intrusive in the patient's mouth. So we use it for our new patients. We also have a system that every recall patient, so every patient that's coming back through the practice, we will update their iTero scans at least annually. So we look at it a bit like how we update their dental radiographs. We look at scanners as being part and parcel of the routine records that we take for our patients. And in this way, we can build up a comparison over time of all the changes that are happening in someone's mouth. And we have a database now of all of the scans that we take for our regular patients. So in our practice, we have everybody trained in taking scans. So our dental nurses take the scans for new patients, and they can take scans at any interval during treatments that we need. We have our dental hygienists and dental therapists trained to take scans, and they will keep track of the routine scans for our regular recall patients. And then of course, all of our dentists will take the scans for the restorative purposes. So we've worked really hard at making sure everyone feels comfortable scanning, and that we have a protocol to teach scanning, and we make it fun as well. So everyone really enjoys being able to be involved in patient. The features of the iTero scanners that we use on a daily basis are being able really to show the patient the digital tour of their mouth. So using Align Oral Health Suite so that we can walk the patient through the different features, using the magnifying glass so that we can show them the HD intraoral camera picture of their mouth as well as the image. And we really love the NIRI, the near infrared imaging image, because we like to show all of our patients the structure of their teeth, but also if there's any calculus buildup, that shows up really clearly on NIRI. So that digital walkthrough in the diagnostic process and patient communication and education is the most valuable tool that we use. So my involvement with the development of the NIRI, the near infrared imaging technology, was right at the beginning of its release in the UK. I was fortunate enough to be part of the limited market release, and we had one of the very first 5D scanners. And I actually used it first of all on my daughter, who was a teenager at that point, and we picked up some early enamel changes in her premolars. And for me, it was really a mindset shift to realize how sensitive NIRI is compared to bite wings, and how we could then take early action and use resin infiltration to reduce the chances of those early lesions from progressing. So NIRI is part and parcel of what we use the scanners for on a daily basis, and I really couldn't work without it now. The benefits of using iTero scanner in practice are, first and foremost, there's a huge wow factor. When patients come in and see the technology and see their mouth as they've never seen it before. There's no doubt in their minds that this is a different experience. So there's a huge increase in trust from the get-go, because patients are seeing the level of investment that we're making in technology and also seeing themselves as they've never seen before. Also, the fact that they don't have to have impressions is huge. I think we forget as dental professionals how uncomfortable it is to have an impression. So that also adds to the patient experience and the trust. The primary benefit of using iTero in practice when it relates to treatment is the accuracy of fit. So because we're doing everything digitally, we don't have that possibility of impressions being warped or having any discrepancies in the impression. So it's very rare now that we have any issues with fit, whether it's crowns or veneers or aligners. Everything fits so much so I've kind of forgotten that we used to have to occasionally send restorations back because there was a slight wobble. That doesn't happen anymore. The other benefit of using iTero is that I can see my preparation on the screen before we're finished the treatment. So away from all of the water and the noise that's going on in the patient's mouth, I can see it, I can expand it, and that gives me confidence that I have done the preparation of a tooth to the best of my abilities. And if I want to change anything, it's so easy just to change that little piece and then go back and capture that scan again. So overall, this adds to the level of accuracy in providing treatment. Working with the iTero scanner has really enhanced the communication with the dental laboratory. Simple things like being able to put the shade photographs directly into my iTero so that they're with the scan of the patient and nothing is getting emailed separately or has a risk of being lost. All the information can go together in real time to the technician, to the laboratory, and we can receive feedback. We can send everything with one iTero scan to the technician, and then using the exocad workflow, we can see the restorations before the technician has even started to manufacture them and give feedback. So the combination of iTero and exocad has really improved the accuracy because we can see any potential issues before the restorations are manufactured. So I love having that dialogue with the technician at that early stage. One of the main benefits of the Lumina scanner is the speed at which it captures the images. So there's no waiting for the scanner head to demist, it's instantly ready, and it also just captures so much information in one sweep, including soft tissue. So one sweep of the wand and the palette is captured. It's really, really fast, which again improves the patient experience and the efficiency of the practice. Another benefit of the Lumina scanner is the photorealism of the image. It's so crystal clear. We thought the 5D Plus was good, and it is really good, but the contrast with Lumina is quite startling. It's crisp, clear, photorealistic image, and the capture of the soft tissue is so much easier and so much more complete. So again, if we're working with the denture workflow or making partial dentures, the ability to capture even the very tricky edentulous areas on a lower ridge is possible with Lumina and really easy. So that's a huge advantage of the Lumina workflow. We invested in our first iTero scanner back in about 2011, and one of the reasons for choosing iTero was because I was aware of its history as a restorative scanner initially, and then the development of that scanner to be able to be used with the Invisalign workflow. And at that point, we were doing a lot of Invisalign, but I also knew I wanted a universal scanner that could handle the restorative workflow, not as a second skill, but as the core of what we use the scanner for. So that's why we looked at iTero, because it fitted with restorative, but also worked with the Invisalign workflow. If my iTero scanners were taken away, I think I would seriously reconsider the work that we do, because they're so part and parcel of every day. I mean, from being able to speak with new patients and show them everything that's going on in their mouth, being able to capture the information so that I can treatment plan remotely, that's a huge benefit. Being able to log into myiTero.com from wherever I am and have that digital version of my patient that I can move the image around, I can think about the occlusion, I can look at all of the different aspects of that mouth to be able to really treatment plan comprehensively. That's been a game changer. We couldn't do that when we had stone models. It didn't work in the same way. So from new patients to monitoring our regular patients to taking our restorative scans, we do a lot of implant work, so taking our full arch implant scans with Lumina is another huge benefit. I really think I would retire if you took my iTero scanners away.